Hey Cam Follows, episode 10. So this is one area that I struggle with again and again and again. We're going to be talking about supplements, also known as nutraceuticals. And it's a very, very big industry, and it has the potential to offer so much good, but there is so much confusion about it. And it makes it very difficult for organisations like CAM to give you hard, fast advice. What we try to do is to use the evidence that is available to us, and this is the problem. There is a lack of evidence. And Gwen's going to take the lead a little bit more about this, of what makes a supplement different to a medication and what does that mean.
So just start with medication. So a medication is a substance which has been shown to be medicinal in some form. So medicinal by presentation, which means the manufacturer is saying this fixes this problem.
Yep.
A medication has to be medicinal by function. So actually there's some research which shows that it modifies a disease or cures a disease or reduces the signs, the clinical signs of a disease. So for example, you're talking about arthritis, it makes them if you say that something makes them less painful, then you're claiming that it's medicinal, and that's medicinal by presentation when the manufacturer is saying it solves this problem. But it needs to have research evidence behind it, and if it becomes a medicine, then it's automatically regulated by the Veterinary Medicines Directorate, or in the case of human medicines, the MHRA. Medicines Health Regulatory Authority, and that is important because vets can prescribe human medications in some circumstances. But the point is, the VMD, the Veterinary Medicines Directorate, they regulate medicines. If it's a supplement, because it hasn't been shown to be medicinal with research, then it's totally unregulated. There are no regulations.
And when you say regulated, just so viewers understand, a medicine has got to be consistently the same in every single batch that is produced. It should be traceable, so everything should have a batch number and should be fully traceable. They should have safety data, so we know what the likelihood of adverse reactions, the frequency, a huge amount of data that takes years. So when a lot of money, and then when a medicine comes out, they're still collecting data on it. So they've done pre-release clinical trials that may take years and years, but when they come out, they're still collecting data from the wider field to try and make sure that they know exactly what that drug can do, how likely it is, what could happen, etc. So there's a huge amount of data which costs money to have that kind of research. Whereas supplements, so companies can do research on their supplement that they've created to try and show that it has a beneficial effect. But then, if they've shown it's had a beneficial effect, it then effectively becomes a medicine, doesn't it? And therefore, the legal situation is that it should then become regulated, but it can't become regulated because it's not a substance that could be identically produced like a drug. Because it's a naturally so if it's a naturally occurring substance, it might have natural variation. That's just one reason why it's difficult to bring a supplement underneath a sort of regulatory banner. But the point is, because the supplement industry is unregulated, it means effectively you don't necessarily know what you're buying. You don't know what's in that bottle or that capsule or that liquid, because there's nobody checking up on them. Only trading standards, I suppose. And so you don't know what you're buying necessarily. You don't necessarily know that it works. You don't know time at
50% of dogs, 80% of dogs. You don't know how long it's going to take to work. And there are some good supplements out there, but the industry is so crammed with stuff and false information, false advertising, as well as alongside the really good information, the really good advertising, the really responsible companies. So
it's really difficult.
And can't see the wood for the trees. So it's really hard for vets to see. So how much more difficult is it for the general public to see
which supplement is a good one and which one is
and
not
it isn't
useful.
just the vet industry. I can remember reading a leaflet that was produced by an independent laboratory that had taken 6 human focused supplements, high street brands, and they independently tested to see whether the content within these tablets was what the packet said they were. And 80% no, they weren't.
They were have what they said was in it.
Really substandard, and that's scary. So when your vet struggles to advise you regarding supplements, there is an inherent difficulty because there isn't a huge amount of evidence there. And what we do know is that these supplements can take quite a while to work as well. So if we were talking about omega-3 fatty acids, which is in general agreement around the globe, because I talk to lots of people around the world, people in this field are in agreement that marine-based cold water omega-3 fatty acids have been shown, EPA, DHA, to have beneficial effect in the inflammatory cascade. So that's great. We're happy with that. But even then, that takes quite a while to get into the system, and that still has disagreement. Some people feel it could take 3 weeks minimum. Some people are saying 12 weeks or longer for those omega-3s to go via your ingestion to become part of the cellular membrane, to be broken down into the anti-inflammatory mediators that it becomes. So this is really difficult, because go back to episode 6, maybe 7, we were talking about pain, and pain needs to be controlled really quickly, because otherwise we risk central sensitization or affecting quality of life, or leading to the dog weight shifting away from a painful area and creating secondary problems. We want to control this pain. We're not going to say to no, start this, it might work in about 12 weeks. We're not going to do that. So what Cam has tried to do, and to try and think through in a most logical fashion, is that we would like to support you in your choice in the supplement system, because there are many out there, but we're also trying to keep you real. We're trying to give you a reality check that there's no promises with them. We would strongly suggest, if you see supplements that have outlandish claims, such as cure, defeat pain, cure pain, eliminate pain, if they use the word arthritis, if they are using clinical terminology, steer clear, because that is against regulations.
Yeah, they're not meant to be, so...
So you wonder if they don't respect that, are they respecting content? So be careful of those outlandish claims. But as said, definitely use the most affordable that you can. So we would always suggest that you use veterinary focus supplements, because companies that are supplying to the vet industry have a greater understanding about traceability, batch numbers, reliability. They've generally got clinical trials that they refer to, and they seem to be more consistent in their content. So please look at the veterinary driven ones initially.
There's also dose as well, so they're going to be more adapted for dose to the size of animal that we're looking at, rather than taking a human supplement and you don't really have a clue how much you should be giving, because you can't just say a dog is a small human, because they might be absorbing it differently.
Exactly.
So,
and a lot of data is extrapolated from the human world, but the digestive tract, the absorption, it is different for dogs. So just because something might have worked for humans, it doesn't necessarily mean it's going to work for dogs. So, as I say, we suggest, yes, do explore them. We do say, buy the best that you can and try and stick to veterinary. Be realistic about the time to effect, and don't leave your dog in pain whilst you're waiting for your supplement to kick in.
And tell your vet that you've given these supplements, because some of them will change the way possibly drugs are metabolised.
Yeah.
And they can even do things like some supplements cause a little bit of a blood thinning effect. It's subtle, but if your dog is on other drugs which might affect blood clotting, for example, this is just one example.
And it might affect
your
liver values, etc.
Vet needs to know about it.
Definitely needs to know. And then, having pondered this for many, many years, because we watch Holly's Army and we have some supplements that seem to be doing amazingly, and we have other people saying, didn't touch my dog. So how can you have such a wide array of potential responses? So some dogs that take turmeric, the owners just can't sing its praises enough. And then you have other owners that have tried it and said, made my dog terribly sick, didn't touch my dog, I saw no benefit whatsoever. How can you have such a wide, diverse response rate? So the only way that we figured that we could help you is to teach you how to be objective. So going back to episode 2, where we were talking about chronic pain signs. In a later episode, we're going to talk to you about quantifying that and objectively monitoring it, so that when you introduce a supplement, you are in the position to be able to make a call of whether you feel it's having good effect. So say that you do choose to use a mixed batch supplement that's got glucosamine and chondroitin and MSM and something else in it, but it's going to be costing you £40-50 a month, and that's quite an outlay. How can we help you make a decision whether that is worth it? Because that might be at the expense of 2 hydrotherapy sessions. In a later episode, we hope to teach you how to be more objective so that you can be confident about making these decisions. What I would say as a take home, and this is my opinion, they are part of the plan. They are not the plan. Supplements are that. They supplement a plan. If they were more, they'd be called the answer. So please, let's keep this all in perspective. Multimodal management is important. Believing a label from a company that you bought off eBay and expecting it to potentially cure your dog's disease is very, very, very unlikely. And I feel very bad on them, bad people, for even suggesting that that's possible. True?
Yeah.
Cool. I'm going to see you for episode 11 next. See ya!